We're live in the studio to discuss incidents of cardiac arrest. He's a cardiologist. He's the head of the Cardiology Unit, Department of Internal Medicine at the National Hospital here in Abuja. Looks like, well, I didn't actually get the name there. Good to see you, and thanks for your time. And thanks for your time, as always. Let's quickly talk about what we're dealing with.
Oladipupo, Fasan. Thank you so much for joining us.
Yeah, because it looks like this is not the first time we've seen such happen. In times past, we've seen a few people, Nigerians especially, collapsing during such heated match. It brings us to how well we go to know about our well-being, our health. You're a cardiologist. Let us in on the simple things, perhaps, that we're missing out on this.
Okay. Thanks for having me once again. So when we talk about sudden cardiac death, basically what we are saying is that some kind of death that occurs rapidly, usually within 1 hour of its onset, and is due to a cardiovascular problem. So when we have sudden cardiac death, it means the kind of death that happens rapidly, and is because the heart has stopped working. Now, for the heart to stop working, there are different causes or different reasons that could make that happen. Some of them are largely due to what we call structural heart, a background structural heart disease in the person, in the subject, or sometimes what we call coronary artery disease, which means there's some level of blockage or obstruction to the blood flow to the heart, to the muscle of the heart, and probably the person didn't know before then. There are also instances where the heart can have abnormal electrical activity, because the heart really can be likened to a car.
Okay.
You know, the car has the mechanical part, which is the engine box, and it has the electrical part. So the heart has an electrical part, which is the electrical activity that happens just before the mechanical contraction. So either way, people can have sudden cardiac death. Someone might not have any structural problem in the heart, but the electrical problem goes haywire and the heart just stops working, or beats quite irregularly, and then the person goes down. If the person is not resuscitated on time, that's the end of it. So it could be either background structural heart problem, or in some instances there's no structural heart problem but electrical abnormality.
Okay. Can we simplify it in a way that we will? Ordinary, untrained Nigerians in the medical field will understand as to, number one, the predisposing factors. I mean, you know, what are the underlying factors? And then again, what signs really should you be looking out for, you know, to ensure that maybe come Sunday, we're not shouting and screaming.
Screaming, right?
Yeah.
Yeah, you're
right.
right.
It's a serious matter.
Yeah.
Yeah.
So basically, when we discuss this entity, we know that quite a large chunk of people who have sudden cardiac death probably harbor some risk factors or even have some cardiovascular condition already. So what are these conditions? For instance, high blood pressure. Right. We know that for a large number of cases of people who have sudden cardiac death, hypertension is the harbinger. And a lot of people don't know they're hypertensive because they don't check. Those that know, they don't get to see the doctor to take their medications to get it controlled. So a large number of, for instance, we know that roughly 3-4 out of 10 Nigerians have high blood pressure and know. 3 to 4 people out of 10. Every 10 have high blood pressure. And
that's troubling, isn't it?
It is, really. And out of that number, about half of them don't even bother about taking their medications. A certain number as well, even though they get to take medications, the BP is still not well controlled. So either way, you don't know, you know BP is not controlled, the risk is there. And you can imagine if someone who has high blood pressure probably didn't know about it or even knows but is not on medication, gets heightened emotionally, the blood pressure can surge. And a sudden rise in blood pressure can do many things. It can cause a stroke, it can cause a heart problem, heart attack, can make the heart quiver, and that's the end of it.
You know, I'm thinking about our checkup, medical checkup. I recall it was in 1996 after the Olympic Games that Wankwo Kanu was discovered to have a problem. Yes. And since then, many have been discovered. You don't uncover these things if they don't come to experts like yourself. And we also painfully had young Ojubo say that the father already had a heart problem. And so how do we really have this culture? We'll come back to defibrillator, which we don't have in a lot of public places. How do we bring this culture of easily getting to experts like yourselves to check ourselves and to see that we're fit and proper, and even if we're ill, we know what we're dealing with?
And not self-medicating, which is another problem.
That's a lovely question, actually. And really, if we want to just talk about this, we must look at it from different angles.
Yeah.
Because we know that preventive medicine is the way to go. I mean, we don't want someone to have a heart attack before we start handling it. I mean, and if you're in a resource-poor society like ours, once you have the condition, I mean, the chances of being managed or even getting to the hospital on time, it has issues. So prevention is the key. And of course, as they say, a stitch in time saves nine. So how do we go about it? Yeah, there must be committed effort from policymakers, because public health is a policy thing. And if you talk about reaching the larger society, the largest number of people, it must be public-oriented. And this public orientation is at different levels. It even starts from teaching, having the right curriculum in school that embraces the teaching of basic life support strategies. How to identify when somebody falls down beside you, what to do, how to help the person. I can tell you, if you go on the street and someone falls down, the first instinct of an average Nigerian is to first run away. Yeah. Or to even laugh at the person.
Or crowd the person without providing any help.
Or start speaking in tongues on the person, when what they should do really is to assess if the person needs help at that time. So when we don't even have this concept, where do we start from?
It's a good opportunity actually to walk us through what you need to do in such a situation. When you find somebody
falls?
What's the immediate help you can actually provide the person?
When someone falls, the first thing is to be sure of the environment. Because you want to help the person, your safety is number one.
Great.
So for instance, if somebody gets electrocuted and is on the ground, you can't rush in. Yeah. I mean, the naked wire might be there. So first thing is safety. But once you're able to if someone crosses the road and the car hits the person, you can't run to the middle of the road when other cars are coming. Right. So safety is number one. But once that has been done, the next thing is to find out if the person is alive. Call the person, touch the person, tap the person. If the person is alive, great. The next thing is to now find a position, put the person in a position or in an area that is safe. So you move the person away from the danger. Now, it is important in that movement, because sometimes if it's due to trauma and there is a partly damaged, half-severed structure, if you don't move the person rightly, you
could do more damage.
Do more harm. Okay? If the person is not responding, that's where the problem is. And that's where we talk about ABC of resuscitation. So you look at the person, you call the person, you look at the airways. Is there anything blocking? Because sometimes when people pass out and they go unconscious, their tongue can just fall back into their mouth and they can't breathe at that time. So it might just be to help the person sweep the tongue forward, and they are able to breathe. It might be, you know, some obstruction, something causing an obstruction in the airway. Anyway, the first thing is check the airway. Is this person breathing? And if the person is breathing, it also goes a long way. If the person is not breathing,
it's another matter.
You check
entirely.
the pulse. Is there a pulse? If there's no pulse, then we start talking about CPR, which
is the pressure.
Chest compressions we do. And really, how many people know about CPR?
It's a good place to leave it. Dr. Oladipupo Fasan is head cardiology, Department of Internal Medicine, National Hospital, right here in Abuja. Thank you very much for joining us. We're better educated.